Our second speaker this morning is the Greens spokesperson on ageing, West Australian Senator Rachel Siewert.
I've been a spokesperson on aged care for 2 years, and that has been an extremely high learning curve, and I've thoroughly enjoyed it, I've got to say. And I've learnt the language. I know about COPO, ACAR, ACAT teams, etc. Because this is a very important sector, and there are many issues to get your head around. Everywhere I go, I've been hearing about the crisis facing aged care, and what the Greens did is put out a discussion paper which I think many of your organisations responded to. And in a response to your feedback, we have released just on Sunday our paper on aged care for the future. We know we face a growing demand for aged care. We know that we are ill-prepared to meet that demand. Just last week, we've heard the figures this morning around the growing demand. Just last week, we heard that demand is likely to be higher, particularly when we take into account the issues around dementia, and then instead of the requirement for the demand around increasing by about 450%, it's estimated we may be increasing demand by about 750%. We clearly need to prepare for that. The approach that the Greens have taken is that we know that we have a growing demand, but we need to plan for that now. There's no use saying, let's just keep going, tinkering around the edges now and expect everything to be right by 2050. So our approach is that we need to fix some of the most immediate issues that need fixing, and we need to put in place some structural reform for the future. And part of that is ensuring that we're putting in place preventative health measures, where we're keeping people well and active and healthy and members of their community. So that's where we're sort of trying to frame where we're coming from with our policy measures. We also believe, and we're a bit concerned about the fact that we seem to be saying doom and gloom about there's an ageing population, there's doom and gloom around that. We should be valuing our ageing population. We should be talking about positive ageing, which is, again, the measures that we need to be putting in place to encourage people to be active members of the community. How do we change our workforce practices to ensure that people can age in place and remain members of the working community? That may mean you don't want to work 24/7, as is the want now, as is now. How do we value people's role in non-government organisations, for example? The vast bulk of our volunteer community are middle-aged and older Australians. How do we ensure that we're valuing and supporting that work in community is another key role of where we're coming from in our policies. I'll get back to the most immediate issues. The feedback that we got, of course, and we all know that there's an increasing gap between what's paid for care, particularly in high care, and what it actually costs. So one of the key things we actually need to be doing is benchmarking the true cost of care. If you ask anybody about what the true cost of care is, it's very hard to know that. We do know the gap is increasing. We do know that in my home state of Western Australia, 60% of providers are reporting they're operating in the red. If you ask the Department of Health and Ageing about that, you're continuing in conflict about it. We need to actually understand what the true cost of care is. So one of the things that we're suggesting is that we immediately work out and benchmark the cost of care. While we're doing that, we can't afford to wait, however, because we know that there's, as I said, there's increasing gap in the cost of care. We actually need to be restoring the cap indexation of 1.75%. So we believe that we need to be doing that immediately. In WA, and I know in other states, half the bed licences that were issued or put out last year were not taken up. So just putting more beds out there is not going to work if we're not dealing with the other structural barriers. So that's why we're very strongly coming from the perspective of saying that or putting in place better indexation and dealing with that cost of care. We also need to be, and that's not just residential care, that's also community care. We know that the money that was providing for now where we could previously have 7 hours of care, community care, we're now only being able to do 5 hours of community care. We know we've got dysfunction across the states between federal and states over HAC services. We need to solve that issue. We need to be very clear about supporting people to age in place. So we very strongly need to focus on ageing in place. We are very concerned, and we repeatedly heard the message around the issues of lack of equity for people that work in aged care services. So one of the things that we clearly need to do, 7 minutes isn't long when you're talking about this issue, is it, folks? One of the issues that we clearly need to do is immediately start addressing that gap in care. And again, I know this issue is rolling out across Australia. In Western Australia, the boom's about to take off again, and we are going to be losing people from aged care. So we need to be dealing with that pay equity issue in community services. We also need to be better supporting family care and informal carers and volunteer. I do quickly want to move on to the long-term picture, and that is we believe we need to be moving much more towards a consumer-directed funding model. We believe we need an independent national aged care authority, and we also strongly support the issues and developing a much stronger approach to a national network of teaching nursing homes. We believe that structure needs to be put in place in the long term. If we don't start planning now, we need to address the immediate issues, there's absolutely no doubt about it. But if we don't start planning now about how we value our aged, about positive ageing, about preventative health, and putting in a better structure, we are going to be facing a very big crisis in the future. And we don't want that. It's not an appropriate way to support our ageing population. We need to value our ageing population and not see it as a burden. It's a value. It's a strong community values its elders, and that's what we need to be doing. Thank you.
Our third speaker is the Minister for Ageing and the Labor member for the New South Wales seat of Richmond, Justine Elliott.
Thank you, Peter, and good morning to everyone. Can I start by acknowledging all of those involved with the Grand Plan and the wonderful work that you are in fact doing. Can I say it's been the Labor government that's had major commitments when it comes to health, hospital and aged care reform. And at the very centre of all of that, it's about people. It's about the people that are having the services provided for them, the care provided to them. It's about the people that provide the care for them, and it's also about people in the future that will be needing care. That has been at the centre of everything we've done with our major reforms right across all of those areas. On the day the election was called, the Campaign for the Care of Older Australians issued a media release, and it said, the key thing we need to see at this election is a commitment from all parties to support the fundamental reform of our residential and community aged care system. And almost immediately, Labor, through our Prime Minister, reaffirmed our commitment to further reform. The Coalition hasn't done that. They want to throw out the COAG Health Reform Agreement, and that includes reforms that will mean the transfer of funding and policy responsibility to one level of government so we can build a national aged care system. As I said, since coming into office, we've been reforming the health, hospital and aged care system. In aged care, we've delivered more places. We've increased funding. We have a commitment to upskilling and building the aged care workforce for now and into the future. We're improving access to medical services, and also we've increased protections for our older Australians who are receiving care. When it comes to places, we've delivered more than 10,000 aged care places. They've become operational in that time. 879 new transition care places. There's low-cost finance to support the development of new aged care places, and 111 of those are already delivering services, and another 848 are under construction now in the planning and construction phases. We've increased funding by nearly 30%, almost double the increase in funding during the last term of the previous Coalition government. We also introduced a historical increase in the pension, and when it comes to aged care, that pension increase was shared between the care recipients and the aged care providers, delivering an additional $713 million to the sector. We also locked the conditional adjustment payment to the forward estimates worth $2.3 billion over 4 years, introduced the aged care funding instrument, also increased the viability supplement to rural and remote providers. And also, Commonwealth funding for home and community care increased up to $185 million to almost $1.3 billion in 2010-11. We also had many initiatives for supporting and building the aged care workforce, for training so many more aged care workers, over 25,000. We set aside 50,000 places in the Productivity Places program as well. And better access to medical services. We introduced the Aged Care Access Initiative. Since that time, the number of GP services and aged care facilities has increased by 11%. And of course, this really reduced those unnecessary admissions to hospitals and took pressure off our hospital system. We've strengthened protections for residents, expanded information that was available on the Aged Care Australia website. And really importantly, our support for the Dementia Initiative has increased to $135 million a year. Our record is very strong, we're very proud of it, and our commitment to reform is in fact unquestionable. Our plans for the future. A re-elected Gillard Labor government will continue to pursue these further reforms. Over the next 4 years, what we'll be doing is building a modern aged care system. We'll take full funding and policy responsibility for aged care. This is a reform that people have waited decades for. We'll have a nationally consistent system so that people can move through it depending upon their care needs and as those care needs change. We'll establish one-stop shop so that people can actually get information about aged care, whether it happens to be home maintenance they need or high-level residential care, so that people can actually get that information when they do require it. We'll also require local hospital networks to work with aged care providers to improve care outcomes. We want to see a much better integrated system so that people get the appropriate care at the right time. We'll also provide additional support for older patients in hospitals to fund their care if an aged care place is not immediately available. We'll provide support for more aged care places. Our zero interest loans initiative, within that we'll be delivering $600 million to support up to 5,000 aged care places. We'll be rolling out 1,200 consumer-directed care places and roll out the final 651 transition care places. We're investing $1.6 billion for more than 1,300 new subacute care places, and also investing $122 million in capital investments in subacute care for multi-purpose services. And we'll work with the states and territories to improve planning processes so that new facilities can become operational a lot more quickly. We've also got a huge commitment to improving the workforce. Now, at the very heart of our aged care system are our wonderful aged care workers. Their dedication and their commitment is absolutely inspiring. We'll be investing more than $310 million for more than 31,000 aged care training places, providing a clear career path for them to upskill and move through the system, providing incentives for them, also providing a lot more GP access to our nursing homes. And when it comes to reform, we've got the Productivity Commission inquiry looking at all of the future needs of our aged care system. So let's contrast all of that with what the Coalition's putting forward. The Coalition supports cuts to services. With their plan, it will not result in their new aged care places. They'll cut the GP incentives, they'll scrap the 2,000 transition care places, they'll scrap the zero interest real loans program, they'll throw out the COVE reform, they'll stop that reform that means we get a nationally consistent aged care system. They'll scrap the Productivity Places program, and they'll scrap the national broadband network. And of course that is so important for e-health. It really is absolutely important, and the Coalition will scrap all of that. We've made our commitments. We're committed to reform for the future. We stand on our record of introducing many improvements for aged care. We've got many reforms in place for the future, particularly along workforce initiatives, improving GP access to nursing homes, so vitally important. That is all under threat because the Coalition have said they'll be scrapping all of those programs. So when it comes to August 21st and we look and compare, what we have is a Gillard Labor government committed to reform. We certainly have a very strong record, and we have a strong desire to be building a national aged care system for the future care of our older Australians. And we contrast that with what we have with Tony Abbott and the Coalition. As the Minister for Health, Tony Abbott ripped $1 billion out of our hospital system, $1 billion. He underfunded aged care. He failed to provide for the future. He failed to plan. We're committed to planning, and we're committed to working with older Australians. We're committed to working with everyone in the aged care sector, committed to working with those working within aged care to build a truly nationally consistent aged care system. And as I said, this has been called upon for decades and decades, but it is only a Gillard Labor government that can truly deliver the reforms that are needed to build the aged care system of the future.